Okay, well, first of all, Dr. Peter Kim did the land acknowledgement. I'll just say that this hospital, the largest in Western Canada, second largest in the entire nation, we sit on unceded territory of the Indigenous groups, and unceded means that there are no land treaties. We are squatting on Indigenous land, and that's an important concept that I tell all my students and trainees. Secondly, after last night, maybe we're not so enthusiastic about this, but go Canucks go. I have a lot of disclosures, but I'm going to say the most important one is not on here. I have slides I've taken from the internet, pictures I've taken from the internet, and I use the legal principle, I invoke the legal principle of fair comment, which allows the use of copyright material for education and criticism. So I invoke fair comment. Monica may not be able to put this on the website, but I can certainly show you and talk to you. And Ed already did a great talk about where the liver is tucked under your right rib cage. And if you ever watch a football game, BC Lions or Seattle Seahawks, you ever notice how when the quarterback hands the ball to the running back, they tuck it under their right rib cage and run forward? Well, they're protecting their liver with the ball. So Ed already did a great job about what your liver does, but frankly, you cannot live without your liver. It has multi-purposes. It gets rid of toxic materials. It produces vital proteins. Next to your brain and your heart, you cannot live without your liver. You can live on dialysis if your kidneys are shot forever, to be honest with you. Now, what causes liver disease? Well, there's a lot of stuff, and we'll go over it slowly. But the reality is, it's like the laundry list on your in your hotel room for laundry services. It's this checklist. There are just so many liver diseases. It's even hard for us to keep track of them. Um, but all roads can lead to hell. And in the case of liver disease, not all roads will lead to hell, but can potentially lead to hell. So just keep an eye on that. Now, what is hell? Well, let me tell you, death by liver disease is probably the worst way to die, to be honest with you. I think it's easier to die just of a heart attack or something. It's like you're awake and next thing you're not. Liver disease goes on, your death goes on for months and months, and it's just terrible. Most people in early liver disease, they have no symptoms. They're all like everybody in this room. And then bad things happen, as Richard's son experienced. You start to feel tired. Maybe you're puking a lot. Your urine turns dark, you're itching. I'll go over that in a second. But basically, you go from this healthy liver in one corner, you start accumulating the scar tissue, what we call fibrosis. And then your liver becomes really scarred up. It can still function, but there's a lot of, about all your blood flow goes through your liver. Well, imagine trying to drain your pipes and it's all clogged up and there's a tremendous amount of backflow. Everybody who's had a house or apartment knows this happens. Well, that's what happens with your liver. And then you get liver cancer, and Mike Walitsky will give us a very excellent talk on that. So I won't say too much more about that. So, what happens when you have cirrhosis? Well, I'll be honest with you. There's a lot of people sitting on SkyTrain who probably have cirrhosis and they have no idea. Why? Because they're feeling great. They don't even know they have liver disease. They need some doctor who does some special tests, whether it's a liver biopsy or a liver or fiber scan, to tell them you have cirrhosis. And they're in denial. What? But I feel great. Yeah, that's what most people with early cirrhosis feel. They feel great. But then bad things start to happen. Now, I'm a gastroenterologist as well as a hepatologist, and we do these things called endoscopy, and I'm just going to show you a picture, but I threw this one on so you know exactly the context. So we put a scope down the mouth, into the esophagus, into the stomach. That's called a gastroscopy. Well, I took this picture many, many years ago, and this this is sitting just above where that junction, the stomach and the esophagus is, right there. And you know, those ropey red things with red bumps, those are blood vessels that usually you don't see. But if you have a scarred up liver, there's so much back pressure that they become dilated and hugely dilated. And and then once they get so much back pressure and overfilled, they just rupture. Like you know, like that balloon that gets overinflated and just bursts. And I took this picture too. I took this picture about 30 years ago, but this is a spurting varix. Like that thing there has gone to this, and now it's spurting blood. Okay, that's really a bad situation. Your likelihood of bleeding out and dying is about 20%, and then we throw some bands on and we rescue you. But you know, that's not a good situation. Imagine if you're on an airplane when that happens. Oh, you're in big trouble. Now, this is a picture of somebody, and I can't really tell if this is a man or a woman, largely because in end-stage liver disease, all your female hormones, estrogen and progesterone, predominate, and we give medications that also cause breast budding. So it's really hard to tell whether this is actually a man or a woman, but you can accumulate this fluid. Like you can accumulate shocking amounts of fluid. About 20 liters is not necessarily unusual. And imagine trying to breathe when you know you got 20 liters of fluid there. Your diaphragms are, instead of taking a deep breath, they're just going like this. I mean, you're panting and you're basically suffocating because you can't breathe. And then there's hepatic encephalopathy, which we call HE, and it looks it presents almost like Alzheimer's disease. I mean, the patients who have it get lost, they get confused, they can't remember anything, and it fluctuates, just like Alzheimer's in the early stage. You know, they fluctuate. Sometimes patients with Alzheimer's or relatives with Alzheimer's look great one day and next day they're not. I think most have experienced this because Alzheimer's is so prevalent in our society these days. And this is why people with hepatic encephalopathy are not allowed to drive. One of our great GI fellows has just done a survey of 180 physicians and medical trainees, and he discovered that 80% really didn't know that they were supposed to tell their patients with encephalopathy they cannot drive. Well, it's right there in the Department of Motor Vehicles that legally anybody with cognitive impairment, including from cirrhosis, is not allowed to drive. So what happens if you decide, okay, to hell with the doctors, I'm feeling good today, I'm going to drive, and you get into an accident? ICBC may decide that, oh, you were told you cannot drive, you're not legally allowed to drive, we're not honoring your insurance, and you're on the hook for all those damages. Okay, that comment is enough to make 99% of patients who I've told not to drive say, okay, I'm not going to drive anymore. And okay, there are these medications that treat your hepatic encephalopathy. You still can't drive. Why? How do we know that you're going to take that 100% of the time? Secondly, how do we know that's going to work 100% of the time? That 1 to 10% of the time that you didn't take it or it didn't work, you could drive into a tree or drive into a school bus and kill a bunch of kids. So if you have hepatic encephalopathy, you ain't driving. Let me just tell you that. If your eye looks like this, and I believe Richard's son's eyes did look like this, that's actually a bad sign. That means that without somebody fixing your liver, you're not going to be alive. You're not going to be around on this world for very much longer. You know, maybe a few months, 1 or 2 years, but yeah, it's not looking pretty good for you if your eye looks like this. Okay, itchy skin if you have liver disease, especially the ones called primary, you know, what we call cholestatic liver diseases like primary biliary cholangitis, primary sclerosing cholangitis, the itching is terrible. You know, patients they literally rip their skins off. They totally excoriate. It looks like they got into a fight with an angry house cat. It's like that. And Mike's going to talk about liver cancer, but no, this was a picture taken from VGH, and yeah, they can be right on the surface, and if they rupture, oh, that's just like being shot with a 9 millimeter pistol right in your abdomen. You lose your blood pressure real fast because all your blood is going into your abdomen. Let's talk about hepatitis. Well, hepatitis, anything that causes inflammation damage is actually technically a hepatitis. So viral hepatitis, oh yeah, infectious. Alcoholic hepatitis, because your immune system is attacking the alcohol that's affected your liver. Um, Dysregulated immune systems attacking your liver. Even medications, we can sometimes call them drug-induced hepatitis. So let's talk about acute and chronic. Chronic means it's been there for a long time. Definition is greater than 6 months, but frankly, it could be 6 years, it could be 16 years. Acute means it happened just newly, and acute hepatitis, like hepatitis A, usually it doesn't cause cirrhosis. But I throw this on because every year it seems that Peter and Mike have to transplant somebody with acute hepatitis A. And it's totally preventable because there's a vaccine. Everybody should get that vaccine. One shot. It gives you lifetime immunity, and you don't have to worry about cirrhosis or anything. Hepatitis B, very common worldwide, as Ed alluded to. Asia, Africa, Mediterranean parts of Europe, those kind of things. Hepatitis C is kind of everywhere, to be honest with you. But, I think that by 2030, hepatitis C will be hopefully eradicated, according to the World Health Organization. Mode of transmission of hepatitis A, well, there are periodic outbreaks that you read about or hear about in the news because somebody went to a restaurant, drive-through, and there was an employee who had hepatitis A, and he gave it to all the customers. That's not uncommon. That's why people who work in the food industry are supposed to wash their hands after they go to the bathroom. That's why don't eat raw oysters in strange areas. That's the other thing. Hepatitis B, well, there's two kinds of transmission. There's the ones that happen through exchange of blood products, what we call horizontal transmission, sexual, drugs. But the truth is, in most of the world, Asia, Africa, it's actually passed down from mother to child. BC, we have a lot of hepatitis B that was transmitted from mother to child. That's why this is an important part and why a lot of people in our province have hepatitis B. Well, symptoms, again, usually don't have any symptoms until your liver fails. Treatments, we have really great treatments for that now. We don't have anything that's going to eliminate your virus once and for all, but we have drugs that will suppress the virus and have no side effects, and you will live happily ever after. Just take that one pill a day. And there's a vaccine. I think probably everybody should get vaccinated. Hepatitis C, mode of transmission, well, usually it's blood to blood, that kind of thing, drugs. Very hard to get it sexually, to be honest with you. Again, the symptoms usually don't happen until it's end stage and you need a liver transplant. But you want to be treated before that, and we have great treatments. Yeah, in the United States, it costs $50,000 per patient. They have no side effects. They work about 95 to 99% of the time. But in Canada, in BC, Pharmacare will give people with hepatitis C this drug at no cost. When was the last time the Minister of Health gave anybody a free Mercedes-Benz? Well, we're giving them something that costs as much as a Mercedes-Benz. And I think that's very positive. Now, I throw this on here, not to fat shame anybody, but this guy looks just so much like my brother, who's an oncologist in Sarnia, that I have to throw this in. I know Peter Kwan is going to talk about fatty liver disease. I'm pretty sure in Japan, where sumo wrestling is an obsession, that those guys have it too. But just keep in mind that now non-alcoholic fatty liver disease is actually almost becoming the new normal because it's like there's so many people who have it. I'll bet if you go to some states in the United States, like maybe Florida or someplace, it's probably about 40% of the population that has it. Um, Autoimmune liver disease is much less common, but they are important. Autoimmune hepatitis, primary biliary cholangitis, and primary sclerosing cholangitis. And basically, it's kind of like Star Trek. You know how in Star Trek they got all these aliens firing at the Enterprise? Well, imagine your immune system is suddenly decided it's going to attack your liver, and your liver's under fire from the immune system. That's exactly what happens. And truth and reconciliation. Well, I throw this on here because there is a stereotype that everybody who is indigenous who has liver disease, it's all because of alcohol. And part of that was perpetuated by the government, the federal government. They mixed, they joined alcohol addiction with liver disease in their healthcare plan for indigenous communities. And that's how that stereotype kind of became established in medical culture. Well, I can tell you right now that the people I work with, we know that it's not true, and for reasons that are not clear in the province of BC, especially on the coast of the Pacific Ocean, there is a lot of autoimmune liver diseases in the indigenous communities, and for other reasons also that I'm not certain about, but in South Alaska, which is the Alaskan Panhandle, they have tremendous autoimmune liver disease problems in their indigenous communities as well. Now, it could be, you look at anybody who's been on a cruise ship has been around that area. It's the same route as a cruise ship. And the indigenous cultures are very similar compared to, say, the prairie provinces of Alberta or Ontario. So I don't know, maybe it's partly genetic, maybe it's migration patterns. I don't know, but it certainly is a real issue. I'm going to talk about hemochromatosis. Now, in the United States, I took this from the internet. 1 in 250 Americans has genetic hemochromatosis. Are you one of them? Well, that's 1 in 250 white Americans, right? Not necessarily Hispanic Americans, not necessarily African Americans, and certainly not Asian Americans, but 1 in 250 Caucasian, non-Hispanic Caucasian Americans may have genetic hemochromatosis. And it all started from a mutation in Europe way, way back in the day. So how has that persisted in the population? At some point, it must have been adaptive. Otherwise, it would have died out, right? That's the way evolution and natural selection works. It must have been adaptive. But I think this is Seoul, Korea. I'm not 100% certain because I've never been to Seoul. But, in Asia, it's like, all hemochromatosis is basically, it's not there, right? So you can usually tell who's at risk just by kind of talking to them and looking at them. And hemochromatosis is, this is a nice cartoon picture of Tony Stark, the Iron Man from the movies. But hemochromatosis affects not only your liver, but it can affect your pancreas, so you get diabetes. It can affect your skin, such your skin's bronze. It can affect your joints. It's just simply, it can affect your heart and cause your heart to fail. It's simply a bad kind of disease to have, and it's readily treatable. You just donate blood all the time. That's all you need to do. I'm going to talk about alcohol. I know Ed has talked about it, but I'm going to be maybe a little bit, I'm going to put my own spin on things. Well, okay, I think this is the leading cause of end-stage liver disease in BC. It increases the risk of not just liver cancer, but I think all cancers, cancers of the head and neck, cancers of the esophagus, cancers of the stomach, cancer of the colon, and cancers of the breast. And it probably, that is almost, the alcohol industry disputes this, but the proof is, it's absolutely undebatable. It increases your global risk, your overall risk of cancer. It contributes to addiction. I suspect that a lot of what happens, addiction to cocaine and opiates, it all probably started with alcohol. Depression, anxiety for sure, harms unborn children, contributes to violent death and injury in society. And I'm going to tell you that we, it's amazing to me that cigarettes have a warning label. And now the federal government is going to put a label on every single individual cigarette. And I think that's a good thing to do. But there are no labels on alcohol products. You can go into any restaurant and you will see signs that say Budweiser and stuff like that. You don't see anything that says alcohol is harmful. For 5 years, I've been working with somebody in government to try and fix that. But let me tell you, that alcohol lobby is pretty. They're a wealthy, powerful lobby, and it's actually more difficult than I anticipated. But I'm going to see this through until the end. And I'm going to say that one of the government people once said to me, "Well, yeah, but we get so much money from alcohol." Well, the difference between the cost of the healthcare system to cost of the criminal justice system, all of which you as the taxpayer are paying for, and the tax revenues from alcohol, it's negative $6.2 billion. Imagine, so every year we are subsidizing the alcohol industry to the tune of $6.2 billion. Imagine if the Prime Minister of Canada said, we're going to give this industry, mining industry, automobile industry, anything, a $6.2 billion subsidy every single year. Okay, like Canadians would be outraged. So why are we giving this industry $6.2 billion a year to offset the deleterious effects of their product? That I don't know. Lastly, I'm going to say that, how many people were at last night's Vancouver Canucks Edmonton Oilers game? The attendance. Well, how many people? What was the seating capacity? Anybody know? Rogers Arena? 18,000. Yes. Well, every single year, alcohol kills 18,000 Canadians every single year, and it wounds a whole bunch more. Imagine every single year, all those people at Rogers Arena are gone, and that happens every single year. To put things in perspective, we live in a country of 39 million. Well, in the United States, they have a country of 333 million. Well, guns are really a problem in the United States of America. Yet gun deaths from guns only kills 39,000 Americans a year. So on a proportionate basis, alcohol is killing more Canadians than guns are killing Americans. And I think that's something to really think about. It's something that gets me personally very angry. I think it's absolutely not right. Now, I'll say that liver transplantation, when things are not going well, liver transplantation will save your life. And we will have a live donor program. We used to have one. Those people were all heroes. And lastly, in a couple of weeks, it will be the 80th anniversary of D-Day, when the greatest forces they landed in Normandy, they defeated the Axis powers and gave us the wonderful society we have. I want you all to think about that on June the 6th. And if this is the only slide you remember today, I'm totally okay with that. Thank you.